Hello everyone, I'm Elle Lee, a licensed clinical social worker and therapist. I've also gone through dialysis and a kidney transplant. I'm joining American Kidney Fund for Kidney Action Week, and in today's mini-series, I'm going to share my patient experience looking for therapy and the best resources to look at. Before I became a therapist and was looking for my own therapist to help with my depression and anxiety, it was a very frustrating, annoying, and time-consuming experience trying to find not just an available therapist, but an affordable one. So after 10 years of seeking therapy on and off, some great and bad experiences, I'm sharing with you where you can find the best accessible mental health resources so you don't have to go through what I did. When I was first looking for therapy, I was a college student, so I couldn't afford paying for the full cost of therapy. And so I looked to my network from school and friends for a good referral. And through word of mouth, I was able to find an affordable therapist who was charging $40 for a 50-minute video session. And it worked out very well because I was able to do therapy from the comfort of my home. The therapist came with high recommendations, so I felt more comfortable going to this person. And she was also trained in cognitive behavioral therapy, which I will talk a little bit more later in this video. So if you're comfortable, I would encourage you to talk to your social worker, other dialysis or transplant patients, and see if they know of a good therapist. Word of mouth is a valuable and a great way to connect with others about their experiences and if they would recommend somebody to you. Another resource is EAPs, also known as Employee Assistant Programs. And if you're working, check with your employer to see if they offer this. And through Employee Assistant Programs, they can offer, depending on your employer's insurance plan, they can offer up to 3 to 6 therapy sessions for free. You are also provided a list that you can choose therapists from that you want to work with. I have found this to be very cost-effective and helpful to just try therapy. And so this is one resource that you can look into. Another resource that I absolutely love so much that I also used to be a therapist on the network is Open Path Collective. They offer affordable individual and couples counseling therapy anywhere between $30 to $60 per session. And they're quite generous on their income limits. So if you qualify, you could definitely use their therapist network to access affordable therapy. Another resource would be looking at private practice therapists and asking if they offer a sliding scale. You can find them on Therapist Network. The two network I would recommend is Mental Health Match and Therapy Den, and I recommend those two because they do try their best to match you with a therapist that would be a good fit for you. I will list these resources in the description below, so you are able to access them. Online therapy is also another resource, and it's just as effective as in-person and one less appointment you have to worry about driving to, right? And that's a win-win. So I encourage you to look into online therapy as well as asking your transplant or dialysis social worker for local and virtual support groups. I've attended a handful of support groups. I've never regret going to them. I have always found them to be so supportive. I learn something new every time, and I've never regret going to one. So that's a free and great one to look into. Another one is looking into free or affordable apps like Calm, Wobot, Bloom. You can try these for a free trial or, something affordable between $10 to $20 a month for a subscription. If let's just say that you don't really know if you want to start therapy, you're unsure, or you just want, some helpful resource for the time being, the, free apps and affordable apps are a great way to get some of that. But I just want to be clear that nothing replaces therapy. Therapy is really a unique experience, and the benefits and the lessons you gain from it is just irreplaceable. The type of therapist that you should look for in a therapist is somebody who specializes in chronic illness or cognitive behavioral therapy and acceptance commitment therapy. Both therapies have been shown to be an effective treatment for chronic kidney disease management. A CBT or acceptance and commitment therapist can help teach you new strategies and tools to improve how you think, therefore changing the impact or hold that chronic kidney disease has on you so that you can continue living your life. And, remember, getting help and finding the right therapist or resource isn't an easy thing to do. Keep pushing forward and don't give up until you find the help that you need. Sometimes it takes several tries before you find a good fit for you. So if you think that this video will be helpful to somebody that you know, please feel free to share it. I would really appreciate it. Thank you for taking the time to watch this, and I wish you all a wonderful day.